Welcome back, guys. Now, after discussing about the male sex hormones, let's discuss about the female sex hormones or the female reproductive hormones. The most important female reproductive hormone which I want you to know is estrogen. Okay, estrogen is not a single hormone. Actually, I should say estrogens. There are different types of estrogens. Already I have explained you in the first video, that's the reproductive hormones topic. There are three different types of estrogens. One is estradiol, next estriol and estrone. Okay, so estradiol means 2 alcohol groups are going to be there, estriol 3 alcoholic groups is going to be there, and estrone, it's a ketone group is going to be there. Okay, so all these estrogens are derived from where? They are all derived from cholesterol. Cholesterol is the raw material for the estrogens. So all these are the steroids. These are the steroid hormones, which means they are derived from the cholesterol. Out of all these three, what is the most important, or I should say, what is the most potent? Which hormone is most potent in nature, highly powerful? Is estradiol is most potent. Okay, most potent, and estriol is going to be seen especially in reproductive age group or during pregnancy, I should say. Okay, during pregnancy, and most important estrogen during the reproductive age group is estradiol. Okay, and after the menopause, okay, so or I should say that during menopause, the most important estrogen that's present in the female is going to be estrone. It's a weaker estrogen. Okay, weak estrogen. Having said that, now let's discuss about the basics. Okay, let's start from the ovary. So in the ovary, what you are going to have? In the ovary, you are going to have lots and lots of eggs. Okay, which are called as the follicles. So there are follicles which are present in the ovaries. Now my question is, what exactly is a follicle, sir? Okay, I am talking about one follicle. So follicle is a oocyte. In the center, you are going to have a oocyte. Okay, it's a real egg. So this oocyte is surrounded by cells. Okay, two different types of cells, which I want you to know for your exam. See, this is one type of cell which I am showing in the red color, and the other type of cell which I am going to show now. So this cell which I am showing in the blue color, it's a different type of cell. So in the center there is a oocyte. Okay, let me put it this way. Okay, in the center there is a oocyte surrounded by two different types of cells. What are the two different types of cells, sir? The first type of cell, okay, which I am showing in the blue color, the first type of cell which I am showing in the blue color is called as a 𝗓𝐞 cell. 𝗓𝐞 cell. And the cell which I am showing in the red color is called as granulosa cell. Okay, so 𝗓𝐞 cell, granulosa cell, and in the center there is going to be oocyte. Now let's discuss about important points about the 𝗓𝐞 cell. So what is this 𝗓𝐞 cell doing, sir? See, 𝗓𝐞 cell is going to convert the cholesterol, whatever the cholesterol is there, that cholesterol will be converted into androstenedione. So cholesterol will be converted into androstenedione. So what exactly is androstenedione? You already know it. The androstenedione is a weaker androgen. Okay, weaker androgens. Okay, androstenedione and dehydroepiandrosterone. These are the weaker androgens. So 𝗓𝐞 cells are going to produce male sex hormones. True, no doubt. When, sir? See, these 𝗓𝐞 cells are under the influence of LH, luteinizing hormone. Okay, luteinizing hormone. Males also, luteinizing hormone is going to help in the production of testosterone. Luteinizing hormone acts on the Leydig cell, so testosterone is produced. In females, it is the luteinizing hormone helps in the production of androstenedione. That's the male sex hormone. But in females, we require the male sex hormones or female sex hormones. We require the female sex hormones. We require the estrogens. So we have to produce the estrogens. So this androstenedione, okay, this androstenedione is going to enter into the granulosa cells. Okay, it's going to come into the granulosa cells. Now, when granulosa cells are stimulated by FSH, okay, so there is one more hormone, FSH, follicle stimulating hormone. So follicle stimulating hormone is going to act on the granulosa cells. Under the influence of this, the granulosa cells are going to convert the androstenedione into estrogens. Okay, the androstenedione is being converted. Okay, let me put it this way. The androstenedione, it is coming like this and it is getting converted into estrogens. Okay, estradiol, that is E2. So, what we have seen? So far, I have discussed that the luteinizing hormone and follicle stimulating hormone, they are acting on two different cells, theca cell and granulosa cells. So, this is called as a two cell two hormone theory. Luteinizing hormone is going to act on the Leydig cells. So, Leydig cells are going to convert cholesterol into androstenedione. That androstenedione is going to come to the granulosa cells. In the granulosa cells, that androstenedione will be converted into estradiol, that is E2. So, this is how estrogens are going to come into the females. So, now tell me, in a female who is in her reproductive age, she is producing estrogens. Okay, which cell is going to produce the estrogen? It is the granulosa cells. Okay, usually we say ovaries are going to produce the estrogens, right? But which cell in the ovary is going to produce the estrogens? It is the granulosa cell which produces the estrogens under the influence of FSH. Not only that, what else I want you to know is, these granulosa cells under the influence of this FSH, they also produce something called as inhibin. Okay, inhibin is also going to be produced. So, what this inhibin is going to do? Estradiol, estrogen as well as inhibin is going to down regulate the FSH, gives the negative feedback. Okay, negative feedback also estrogens. So, estrogen and inhibin, they always down regulate the FSH. Okay, always decrease the levels of FSH. Done. Okay, now for easy understanding purpose, let's write the biochemistry thing here, cholesterol. So, first theca cell. Okay, in the theca cell, what is happening? The cholesterol is going to be converted into pregnenolone. Okay, pregnenolone with the help of desmolase. Okay, the enzyme required is desmo. See, I am discussing all this is because of this one enzyme desmolase. Okay, so cholesterol with the help of enzyme desmolase will be converted into pregnenolone. This pregnenolone will be converted into androstenedione. ASD stands for not atrial septal defect, androstenedione here. Now this androstenedione will be converted. Okay, so androstenedione, first it will come into the granulosa cells. Now in the granulosa cells, this androstenedione, it will be converted into testosterone. Okay, first it will be converted into testosterone. Now this testosterone will be converted into estradiol. So this is in detail. Okay, this is in detail thing. So testosterone will be converted into estradiol with the help of which enzyme? Aromatase. So two important enzymes which I want you to know is desmolase and aromatase. Now I have said you, sir, which hormone is going to act on the theca cells for the production of androstenedione? It is LH. So LH is going to stimulate the desmolase. LH is going to stimulate the desmolase and FSH is going to stimulate the aromatase. So FSH is helping in the conversion of testosterone into estradiol. Okay, so this is the point which I want you to know. So now here let's discuss about the axis. So whatever we have discussed, let's make it more clear. So here there is hypothalamus. Okay, that hypothalamus is going to produce GnRH in the females. The GnRH is going to act on pituitary gland. Okay, pituitary gland. Now the pituitary gland is going to produce gonadotropins. What are the two gonadotropins? LH, FSH, LH and FSH. Now I have explained you that LH is going to act on the theca cells. Okay, LH is going to act on the theca cells, so that now these theca cells are going to produce, okay, theca cells, actually the LH is going to act on the enzyme which is called as the desmolase. So the theca cells are going to produce androstenedione. Now this androstenedione, where it is going? The androstenedione is going to come into cells called as the granulosa cells. Here one more cells are there in the ovary which are called as granulosa cells. This stands for granulosa cells. So now this androstenedione is coming to the granulosa cells. In the granulosa cells, androstenedione will be converted into testosterone. Okay, testosterone. Now that testosterone will be converted into estradiol. Okay. So, this FSH, what this FSH is going to do? FSH is going to activate something called as aromatase. Okay. So, with the help of this enzyme, FSH is activating the aromatase. So, aromatase in the granulosa cell, it is going to convert the testosterone into estradiol, and one more important thing, that is inhibin. Okay. So, what this inhibin and estradiol are going to do? This inhibin and estradiol are going to give negative feedback to pituitary gland as well as to the hypothalamus, negative feedback. Okay. So, this is the axis which I want you to know. Next, what are the functions of the estrogens? Okay, functions of the estrogens. The functions of the estrogen is number 1, follicular development. Okay, estrogen helps in the development of the follicles, true. Next, estrogen helps in breast development. Next, estrogens will act on the endometrium. Okay, estrogens will go to the uterus and will act on the endometrium, helps in endometrial proliferation. Endometrial proliferation. So, these are the 3 important things. Okay. Apart from this, what else I want you to know is the other functions of the estrogens. Okay, other functions of the estrogens. Estrogens in the body, they raises HDL cholesterol and decreases LDL cholesterol. HDL cholesterol, good cholesterol is going to increase and bad cholesterol is going to decrease. This is something good. Apart from this, normally these estrogens are going to bind with the sex hormone binding globulins. Okay, in male reproductive hormones video also I have discussed that estrogens and androgens, they will bind with sex hormone binding globulins. Okay, so the estrogens, what they do is they increases the levels of sex hormone binding globulins. When you have more sex hormone binding globulins, the sex hormone binding globulins are going to bind more with the androgens. Okay, sex hormone binding globulins are increasing because of estrogen. Sex hormone binding globulins are increasing. So, if there is more sex hormone binding globulins, means their affinity towards the androgens is going to be more when compared to estrogens. So, they bind with more androgens in relative to estrogens. When compared to estrogens, androgens are going to be bound much more. So, estrogens are going to be available more. Okay. So, more estrogens are going to be there. So, amplifies the, what I want you to know is, so increase in SHBG is going to amplify estrogen effects. Okay, is going to amplify the estrogen effects. That is the one thing which I want you to know. Okay, next, what else? So, follicular development, breast development, endometrial proliferation, this thing. Okay, and one more thing, during pregnancy. Okay, during pregnancy, again breast enlargement. Okay, again breast enlargement as well as pigmentation of areola. Okay, pigmentation of the areolas. And estrogens are the ones responsible for the female-like morphology. Okay, female-like body. Okay, female habitus. Okay, is because of the estrogens, which means the females are going to have narrow shoulders. Okay, males are going to have the broad shoulders. That V-shaped body is going to be there, right? Narrow the hip region, narrow waist. So, females are going to have narrow shoulders and broad waist. Okay, narrow shoulders and broad okay. So, these are some important effects because of the estrogens. And one more important point, remember, in females, axillary hair growth and pubic hair growth are under the control of androgens. The secondary sexual characters are because of the androgens, not because of the estrogens. Okay. Next, these are the functions, right? What estrogens are doing? I have said you, estrogens will give negative feedback to the pituitary. Once you have enough amount of estrogens, it will give negative feedback to FSH and LH. It decreases the, okay. So, estrogens, what they will do? They decrease FSH secretion as well as LH secretion. Okay, gives the negative feedback. What else is, see, in the mid of the cycle, okay, in the mid of the cycle, see, a female is there, FSH is coming, follicles are growing, follicles are growing, estrogen is getting produced, estrogen continuously estrogen is getting produced. See, when you have sufficient amount of estrogen, when you have that particular level, there is one point somewhere around 200 picograms, that particular concentration, this estrogen will give positive feedback for the release of LH. This is actually like an exception. Normally it gives a negative feedback, but when you have high concentration of estrogen in the mid of the cycle, it's the estrogens gives positive feedback for the LH surge. Estrogens at high concentration, somewhere around 30th day, there is going to be LH surge. Estrogens will give positive feedback for LH surge. So that LH surge is responsible for ovulation. Okay, that is responsible for the ovulation. So these are some important points about the estrogens. So estrogens done. Now let's discuss about progesterone. Okay, progesterone. Now from where this progesterone is coming? First 14 days, it's all estrogens. In a female cycle, 28-day cycle, first 14 days are because of the estrogens, totally under the control of the estrogens. The next 14 days are under the control of the progesterone. So who is going to produce this progesterone, sir? Produced by, synthesized by corpus luteum. Corpus luteum mainly. So what exactly is corpus luteum? Ruptured Graafian follicle. Ruptured Graafian. Okay, ruptured Graafian follicle is called as corpus luteum. Ruptured Graafian follicle is called as the corpus luteum, right? Now, this corpus luteum, what it is producing? It is producing the progesterone. In the name itself, it's there. What is the function of progesterone? Progesterone, progestational hormone, pro-pregnancy. Okay, it's something always related to the pregnancy, helps in the pregnancy, helps in the maintenance of the pregnancy. How it's going to maintain the pregnancy, sir? Okay, see, this progesterone is going to make the cervical mucus thick, thickens cervical mucus. It thickens the cervical mucus. As the cervical mucus is getting thicker, it is very difficult for the sperm to penetrate through such a mucus. Okay, so in the next half of the cycle, it doesn't allow the sperm to go into the uterus. So it thickens the cervical mucus, prevents sperm entry. Okay, sperm entry. Next, during pregnancy, do you want any uterine contractions? Normally, a female body is designed in such a way, every month the uterus will contract. Okay, every month the uterus will contract for the purpose of menstruation, during menstruation. But during pregnancy, do you want any uterine contractions? No, we don't want any such things. So, this progesterone is going to inhibit the uterine contractions, prevents uterine contractions. Okay, next, progesterone increases the body temperature. Okay, that's why pregnant female, her basal body temperature is going to raise by almost 0.5 degrees. Okay, increases the basal body temperature. And not only that, progesterone also gives negative feedback. Just like estrogen is giving negative feedback, progesterone will also give negative feedback. So, negative feedback mainly to LH and FSH. LH and FSH, negative feedback is going to be seen. Okay, these are some important things. So, I want you to know that estrogen and progesterone effects are little opposite. Progesterone, its main effects to oppose estrogens. Its main effect to oppose estrogens, and mainly it favors the pregnancy. Okay, it favors the pregnancy. Here what else I want you to know is progesterone is coming from corpus luteum. Okay, it's coming from corpus luteum. But do you think it is only the corpus luteum that's going to produce the progesterone throughout the 9 months in the pregnancy? No. Corpus luteum produces progesterone, but not only that, even placenta. Okay, so after 3 months, okay, after 3 months, 3 months after the pregnancy, it's the placenta produces progesterone mainly. Okay, not only that, in the in males also, it's adrenal glands which can produce the progesterone. In the body, in the adrenal glands, progesterone is produced from the cholesterol. Progesterone is produced. That progesterone later will be converted into cortisol, aldosterone, and male sex hormones. Progesterone is like a raw material for many hormones. Okay, progesterone is like a raw material. It's like a precursor for many steroid hormones. So, okay, so placenta, not only that, adrenal glands also. So, this is a point which I wanted to know. Next, now let's discuss about the hormonal changes in different people and different age backgrounds. Okay, hormonal changes. Same, estrogen levels are going to be very much more during reproductive age group. Okay, during reproductive age group, the estrogen levels, especially estradiol levels, are going to be very much more. It's not only that, in obese females, estrogen levels are going to be more. Okay, obese women, estrogen levels are going to be more. My question is why? Why a female who is fat is going to have more estrogen levels is because in her body, whatever the androgens that are getting produced, okay, now these androgens, they will come to the fat, adipose tissue. Okay, in her adipose tissue, the more adipose tissue is there, so more peripheral aromatization with the help of same enzyme aromatase. Okay, now the androgens are going to be converted into estrone, weaker form of estrogen, estrone. So androgens are undergoing peripheral aromatization in the adipose tissue into estrone. So estrone is also a type of estrogen, so she is going to have high levels of estrogens. So fat females can have high amount of estrogens when compared to the lean females. And any female, doesn't matter fat or like old or doesn't matter, if a female is having hyperestrogenic states, more estrogen levels are going to be there, high levels of estrogens. That's good or bad? That's definitely going to be bad. Why? High estrogens, hyperestrogenic states are going to be bad because estrogen is like a stimulant. Okay, estrogen is like a stimulant for the growth of endometrium. Too much estrogen can lead to endometrial hyperplasia, and that endometrial hyperplasia can lead to endometrial cancer. So she is at risk of endometrial cancer. Hyperestrogenic states increases the risk of endometrial cancer and breast cancer. Okay, not only that, high levels of estrogens can lead to endometriosis. Okay, endometriosis. Okay, endometriosis means growth of endometrium outside the uterine cavity, and uterine fibroids. Uterine fibroids. Right? So, increased estrogens increases the risk of all these conditions. Next, what about the hormone levels during the menopause? Okay, during menopause, what exactly is occurring? During menopause, we know that in the ovary, the follicles are getting emptied, the follicles are getting exhausted, like completed, totally the follicles are going out, getting depleted, that's what I mean. As the follicles are getting depleted, the estrogen level automatically comes down. Okay, so estrogen levels falls during menopause. Now during menopause, estrogen levels fall. So no estrogen, no negative feedback. So what about the FSH levels? FSH levels are going to be more. Okay, high levels of FSH is going to be seen. So how to establish that she is having menopause, she have entered the menopause is high levels of FSH. Okay, if you see high levels of FSH in the female's blood, it indicates that she have entered into menopause. Okay. Next, what else I want you to know is in a menopause female. Okay, in menopause female, there are unopposed estrogens. So, what are these unopposed estrogens? Let me tell you. Unopposed estrogens. Now, we will get it out. First of all, where they are getting these estrogens? We have just discussed that a menopause female is not going to have the estrogens, but from where these estrogens are coming? These are the weaker estrogens like estrone. From where this estrone is coming? Estrone is coming from peripheral aromatase, okay, from the adipose tissue. Okay, from the adipose tissue, estrogen is getting produced. Now, in a normal female, let me tell you, in a normal female, estrogen is going to be there. That estrogenic effects will be opposed by progesterone. Normally, reproductive age group, estrogen is going to be there, progesterone is going to be there. That estrogenic effects are going to be opposed by the progesterone. Okay, progesterone is going to oppose the effects of estrogen. But now, in this menopausal female, estrogen is coming from the peripheral aromatization, but no progesterone to oppose estrogen effects. So, this unopposed estrogen can going to act on the uterus, and that can lead to endometrial cancer. Okay, endometrial cancer. So, this is going to be especially seen in obese females. So, those obese females who are going to have this adipose tissue, high, like obese females who is going to have lots and lots of adipose tissue, there can be lot of peripheral aromatization. So, lots of estrone. This estrone is unopposed estrone. So, that can act on the uterus and can lead to endometrial carcinoma. So, during menopause, unopposed estrogens are going to be present. Next, what else you should know? We have to discuss some important oral contraceptive pills, what is their mechanism of action and how they are going to be helpful, what are the different types. Okay. First, oral contraceptive pills. Oral contraceptive pills. See, the name itself is that you are taking it orally, the female is taking them orally, and they are helping in contraception. Okay, contraception. Contraception means the female doesn't want to have any pregnancy, so contraception. So, how these pills are going to prevent the pregnancy? We'll discuss. So, oral contraceptive pills, what do they contain? They contain estrogens as well as progestins. Okay, estrogens and progestins, or you can say progesterone. Okay, estrogens and progestins. Now, what are the different types of oral contraceptive pills? Progestin only pills, progestin only pills, progestin only pills, which are also called as mini pill. Okay, mini pill. See how they are going to function. How they are going to function. See, now we are injecting the progestin into the body. What we are injecting? We are injecting the progestin into the body. So, as you are injecting the progestin into the body, so it's like progesterone. It works like progesterone. Progesterone is going to prevent the sperm entry, and progesterone is going to give the negative feedback. Okay, it's going to give the negative feedback for FSH and LH, mainly for the LH. So, without LH, there is no ovulation. Okay, there is no ovulation. Without ovulation, there is no pregnancy. Okay, without ovulation, there is no pregnancy, as simple as that. Okay, and not only that, these progestins, whatever we are going, they are going to continuously, if you are giving progestins, they are going to continuously cause the atrophy. They are going to make the atrophy of the uterine endometrium. Endometrial atrophy is going to occur, so implantation is not going to occur. So that can also prevent the pregnancy from happening. Okay, these are the progestin only pills. Next, there are also combination pills. What are combo pills? Okay, combination pills. So, combination pills, they contain both estrogen plus progesterone. Okay, progesterone. So, estrogen, when you take estrogen and progesterone from outside, 𝐒𝐮𝐬𝐜𝐫𝐢𝐻𝐿, that is the most common estrogen that is going to be taken, and progesterone we are going to take. So, from outside you are taking the estrogens. So, these estrogens, what they will give? They will give the negative feedback to FSH. Without FSH, there is no follicular development. Okay, no follicular development means you know it. Okay, no follicular maturation. Now, the progesterone is going to give the negative feedback to LH. Without LH, there is no ovulation. Simple. Without that, pregnancy cannot occur. Okay. So, what is the most common estrogen that's being used? That's used in the oral contraceptive pills. That estrogen which is used is called as ethanyl estradiol. Ethanyl estradiol. And what is that LH that is most commonly used? LH is norethistron. Norethistron is the LH which is used. Sorry, not LH, sorry. Norethistron is the progesterone. Okay, it's a progesterone, and ethinyl estradiol is the estrogen that is most commonly used in the oral contraceptive pills. Okay, and you know the feedback, and you know the mechanism of action. It suppresses the FSH and LH release via the negative feedback, and not only that, the progesterones, whatever you are taking, they are going to make the cervical mucus thick. Okay, they are going to the oral contraceptive pills, whatever you take, the progesterone component is there, right? It's going to make the cervical mucus thick, so that the sperm penetration cannot occur. Without the sperm penetration, pregnancy cannot occur. But there is one important point is, say these progesterones, whatever you are taking, what I have said, they makes the cervical mucus thick. Now sperms are not entering. Okay, not only sperms, the bacteria can also not able to get access into the uterine cavity. Okay, so the bacteria, whatever is there in the vaginal canal, that bacteria is now unable to get access into the uterine cavity and into the fallopian tubes and into the peritoneal cavity. So it's better, right? Now what I want you to know is, now the thickened cervical mucus is giving protection for the female from pelvic inflammatory disorders or from pelvic inflammatory diseases. Okay, most of the pelvic inflammatory diseases are going to occur by the retrograde route. Okay, that infection have spread from the vagina to the cervix to the uterus, from there to the fallopian tubes and into the peritoneal cavity. So this thick cervical mucus is going to prevent pelvic inflammatory disease. Okay, this is the point which I wanted to know. And I have said you, the progesterone is also going to cause the atrophy of endometrium. Okay, endometrium, which prevents implantation. See, there are some important disadvantages with the progesterone only pills. What are the disadvantages with progesterone only pills is these things, the progesterone only pills, every day she have to take at the same time. Okay, should be taken every day at same time. So if you, for example, because of some reason she is outside, she forgot to take the progesterone pill. Now the progesterone supplementation is not going to go to the endometrium. So whenever the progesterone is not there, there is loss of support for the endometrium. So the endometrium will bleed. Okay, the endometrium is going to bleed. So that is called as a breakthrough bleeding. Okay, so it should be taken every day at the same time. Otherwise, there will be breakthrough bleeding. Okay. Now after discussing about the oral pills. See, oral pills have to taken every day. Okay, there is a chance that she might forget, and there is a risk that she can have breakthrough bleeding, or there is a risk that she can get pregnant. For that, we have certain injectable things. There is something called as medroxyprogesterone. Okay, so medroxyprogesterone. So what exactly is this medroxyprogesterone? This is Depo-Provera, also called as a Depo. So now for one time you are going to take injection, intramuscular injection. Okay, intramuscular injection. Okay, intramuscular injection, or it can be given also subcutaneous route. So this dipomedroxyprogesterone is like a progesterone. It's a progesterone, you know it. So once you have taken the progesterone for the next 3 months, you don't need to take any contraception. Okay, so dipomedroxyprogesterone, it's a IM injection. So it can be taken once in 3 months. Okay, so that's a point which I want you to. Now, see, there are some problems with the progesterone only pills. What is the problem with the progesterone only pills? I have said you. See, the progesterone only pills contain only progesterone. So the endometrium is going to be very thin. Okay, the endometrium is going to be very thin. So there is a breakthrough bleeding. But if I am talking about the oral contraceptive pills, see, oral contraceptive pills, that is combination pills here, combination pills. The combination pills, what they are going to do, there are some important benefits with the combination pills. What is that? These combination pills, they contain both estrogen along with progesterone. Both progesterone is there, progesterone component is going to be there, estrogen component is going to be there. So what is this estrogen doing? Estrogen stabilizes. Okay, estrogen stabilizes the endometrium. Okay, estrogen stabilizes the endometrium, so there is a chance of less breakthrough bleeding. If she is taking only progestin pills, only mini pills, there is a chance that the endometrium become thinner, and there is a chance she can have breakthrough bleeding. Now, in combination pills, she is taking both estrogen as well as progesterone. These estrogens will stabilize the endometrium. So, less breakthrough bleeding is going to be there. Okay. Next, what else? It's going to be better, right? When compared to 1, 2 is going to be better. So, estrogen, whatever you are taking from outside, estrogen decreases the FSH, and progesterone is going to decrease the LH. So, better suppression, okay, better suppression of the follicular development. That's the one thing. And estrogen, okay, increases the effects of progesterone. Estrogen increases the effects of progesterone. Okay, so estrogen, it increases the progesterone receptors. Estrogen increases the progesterone receptor. That's the one thing. So, why I have discussed all this is because when compared to progestin only pills have a risk or have a side effect of easy breakthrough bleeding. But when compared to that, here these combined pills, which is having both estrogen and progesterone, are having less complications. Okay, this is the one point which I want you to know. But what are the problems? Okay, what are the problems with these combined pills? Is here also there is a risk of breakthrough bleeding, but light when compared to the progestin only pills. Yes, there is a risk. Okay, risks or complications, breakthrough bleeding. Okay, breakthrough bleeding. There can be hypertension. So, whoever are using oral contraceptive pills, they can have a risk of hypertension, breakthrough bleeding can be seen. They are taking the estrogens from outside. Estrogens increases the clotting factors in the body. Estrogens increase the clotting factors. So, those females who are continuously taking estrogens, they having a risk of thrombosis, DVT, okay, deep venous thrombosis, or sometimes the thrombosis can even occur in the arteries, okay. So, that can lead to myocardial infarction or even stroke. Oral contraceptive pills, they are little like confusing drugs. They increases the risk of certain cancers, they decreases the risk of certain cancers. What and what? Taking an oral contraceptive pill increases the risk of breast and cervical cancer. Cervical cancer risk, the breast cancer and cervical cancer risk is going to increase. But it decreases the risk of endometrial and ovarian cancer. Okay, they decrease the risk of endometrial cancer and ovarian cancer. Remember, this is a little important. Okay, so which cancers are going to increase, the risk of which cancers is going to increase, and the risk of which cancers is going to decrease. Breast cancer, cervical cancer decrease, endometrial cancer, ovarian cancer increase. Sorry, endometrial cancer, ovarian cancer decrease, breast and cervical cancer increase. Next, what else I want to know is which females are not supposed to take the oral contraceptive pills. Okay, oral contraceptive pills are contraindicated. Okay, absolute contraindicated in which females? Those females who are having previous history of deep venous thrombosis. That female who is having a history of deep venous thrombosis or pulmonary embolism, or that female who is a smoker. Okay, female greater than 35 years of age. Okay, a smoker more than 35 years of age. See, if a female who is more than 35 years of age smoking, okay, a female, when she takes oral contraceptive pills, there is higher chance of thrombosis. Smoking is going to continuously, it's going to cause a damage to the endothelial cells, upon which if you take these oral contraceptive pills, if you increases the estrogen in her body, more chances of thrombosis, so she can have a risk of DVT or even stroke or myocardial infarctions. Okay, cerebrovascular events can occur. So, oral contraceptive pills are absolutely contraindicated in a female who is having a previous history of DVT, or a female who is a smoker more than 35 years. These are the absolute contraindications. So, with this we have completed female reproductive hormones. Hope the video is helpful. Thank you.